Hi friends, good evening and welcome to my channel Mukambika Nursing. Friends, in this video we can see the questions for exam, nursing officer exam. We will see the question one by one. First question, which among the following is an early sign of renal carcinoma? And the options are low back pain, option B hematuria, option C dysuria, option D urinary retention. Here question is which is an early sign, that is first is an early sign of renal carcinoma, that is the question. So the early sign of initial symptoms of renal carcinoma is blood in the urine. So blood in the urine is also known as hematuria, that is the initial symptoms of renal carcinoma. The classical symptoms of renal carcinoma include hematuria, flank pain and an abdominal mass. This is the classical symptoms of renal cancer, and other symptoms include fever, high BP, high blood pressure, night sweat and weight loss are the other symptoms of renal carcinoma. So here the initial sign of renal carcinoma is hematuria. B is correct. Second question, a client has been taking isoniazid INH for 1.5 months. The client complains to a nurse about numbness, paresthesia and tingling in the extremities. The nurse interprets that the client is experiencing option A hypercalcemia, option B peripheral neuritis, option C small blood vessel spasm, option D impaired peripheral circulation. Here our question is, a client is on isoniazid therapy, isoniazid drug, and he complains or client complains that he is having numbness, paresthesia and tingling in the extremities. Here what the nurse will interpret over here, that is the question. So here isoniazid is an anti-tubercular medication. Okay, this common side effect of this isoniazid is peripheral neuritis. So here answer is option B, peripheral neuritis is the correct answer. So isoniazid, the common side effect of isoniazid is peripheral neuritis. How the peripheral neuritis occurs to the patient is that the isoniazid affect the synthesis of vitamin B6. Vitamin B6 is also known as pyridoxine. So it affects the synthesis of vitamin B6. The deficiency of vitamin B6 cause neuritis to the patient. And along with this peripheral neuritis, peripheral neuritis is manifested by numbness, tingling and paresthesia in the extremities. Okay, so this can be minimized by giving pyridoxine, that is vitamin B6 intake. Okay, here answer is option B, peripheral neuritis is the correct answer. Third question, strawberry gingivitis is the characteristic sign of which disease condition? Options are option A carcinoma of breast, option B Wegener's granulomatosis, option C gastric cancer, option D none of this. So our question is strawberry gingivitis is the characteristics features of which disease condition? Okay, that is the question. Here strawberry answer is option B, Wegener's granulomatosis is the correct answer. The strawberry gingivitis is also known as hyperplastic gingival lesion. Okay, hyperplastic gingival lesion is also known as strawberry gingivitis. It is an inflammation and formation of granuloma of blood vessels, that is called Wegener's granulomatous. Okay, so it's an inflammation and formation of granuloma of blood vessels. So here correct answer is option B, Wegener's granulomatous. Strawberry gingivitis is the characteristic features of Wegener's granulomatosis. Fourth question, which of the following components is not present in normal saline? Option A, sodium 154 milliequivalent per liter. Option B, chloride 154 milliequivalent per liter and potassium 52 milliequivalent per liter. This and option D, all of this. So which one of the following component is not present in the normal saline? Here normal saline is sodium plus chloride, that is normal saline, sodium chloride, and potassium is not present in the sodium chloride. So option C, K 52 K plus, that is potassium 52 milli equivalent per liter is the correct. Fifth question, a hormone that stimulates the flow of pancreatic enzyme is, and the options are option A enterokinin, option B trypsin, option C pancreatinocymin, option D enterogastrone. Here question is a hormone that stimulates the flow of pancreatic enzyme, that is known as pancreozymin. Option C is the correct answer. This pancreozymin is also known as cholecystokinin. Okay. Pancreozymin is also known as cholecystokinin, which is secreted or synthesized by the duodenal cells. So here hormone which stimulates the flow of pancreatic enzyme is pancreozymin and or cholecystokinin. Okay. Option C is the correct answer. The next question, sixth question, normal serum magnesium level is, and the options are 1.6 to 2.6 milligram per deciliter, option B 2.8 to 3.2 milligram per deciliter, and option C 2 to 3.6 milligram per deciliter, and option D 3.6 to 4.2 milligram per deciliter. Here normal serum magnesium level is option A 1.6 to 2.6 milligram per deciliter. Normal values and all very important. Normal serum sodium, normal serum potassium, chloride, magnesium, phosphorus, everything is important question. Here our question is normal serum magnesium level. It is 1.6 to 2.6 milligram per deciliter. If it is below 1.6, lower than 1.6 milligram per deciliter is known as hypomagnesemia. If it is above 2.6 milligram per deciliter, it is known as hypermagnesemia. Here our question is normal serum magnesium level, that is 1.6 to 2.6 milligram per deciliter. Option A is correct answer. Seventh question, normal red blood cell count in male, that is normal RBC count in male is option A 3.5 to 4.5 million per microliter, option B 4.5 to 6.2 million per microliter, and option C 5.5 to 6.5 million per microliter, and option D 4.2 to 5 million per microliter. Here normal red blood cell count in male is 4.5 to 6.2 million per microliter or milliliter. That is the correct answer. Option B 4.5 to 6.2 million per microliter is the correct answer. Here that is the normal value in male. If it is in female adult, it is 4.5 to 5 million per microliter. That is in female 4.5 to 5. Okay. Eighth question, the area which is also known as blind spot of human body is, and the options are option A macula lutea, option B fovea centralis, option C optic disc, option D cones. Here question is which is the blind spot of human body. This is the question and the correct answer is option C. Optic disc is the correct answer. Optic disc is the small area in the retina from where the optic nerve leaves the eye. Okay, and this optic disc is also known as a blind spot because it has no light sensitive cells over there. So it is known as blind spot because there is no light sensitive cell in the area, that is known as optic disc or blind spot. So optic disc or blind spot is the area which is known as blind spot is optic disc. Option C is the correct answer. Ninth question, peripheral vision is assessed by. Options are option A Snellen chart, option B slit lamp examination, option C confrontation test, and option D none of this. Our question is peripheral vision of the eye is assessed by using option C confrontation test is the correct answer. Confrontation test is used to assess the peripheral vision. Okay, option C is the correct answer. Next question, the last 10th question, Mc.Donald suturing is done for. Options are option A missed abortion, option B septic abortion, option C recurrent abortion, option D complete abortion. Here our question is McDonald suturing is done for. And the correct answer is option C. Recurrent abortion is the correct answer for this question. And this McDonald suture is also known as Shirodkar operation. Shirodkar operation is also known as McDonald suturing or McDonald surgery. Okay, and this is done around the cervix in a purse string manner. Okay, so in order to prevent abortion, they are doing a suturing that is called the Shirodkar operation or McDonald suturing.